I'm Dr. Elaine, and this is...
I'm Dr. Steph.
We are naturopathic doctors here at Holtorf Medical Group, and we're going to be doing a Google Autocomplete interview. Here.
All right, so we're going to start with, what does a naturopathic doctor actually do?
Excellent question.
A very common question, honestly. No one knows what we do. No one knows what a naturopathic doctor is.
Yeah, they're like, well, what?
All the time.
Yeah.
A naturopathic doctor actually looks into the root cause of your symptoms and treats that instead of just kind of getting rid of symptoms. We get to the root cause and figure out what it is.
Right, and think of us as like the original functional medicine doctors.
It's true. Naturopathic doctors have been doing functional medicine by looking at the whole person for a long time. I mean, that's what naturopathic medicine was founded on.
Yeah. Okay.
All right, next question. What are the 7 principles of naturopathy?
Wait, I thought there were 6. 6?
6? No, I think there are
There
7.
are 7?
We'll see if we can get to 7.
Let's get to them.
Just to say, for those of you who don't know what this is, one of the big things that sets naturopathic medicine apart from other systems of medicine is these founding naturopathic principles. It's kind of what defines naturopathic medicine. So there's 7 of them. First being, doctor is a teacher.
Oh, just kidding.
Skipping ahead. Doctor is teacher.
Yes.
Goal is to educate your patient so they understand what they're doing and why they're doing it.
Mm-hmm. Another one is first, do no harm. That's like pretty much for all medical professionals, but we always want to do the least invasive treatments possible, and then eventually get up to the higher interventions.
Number 3 kind of goes along with the first answers. Treat the cause, not just covering up symptoms, but getting to the root of the issues.
Mm-hmm. Treat the whole person, right? It's not just, one system that we're looking at. All of it plays a factor, and all of it is intertwined and connected.
Number 5 would be healing power of nature. That's a big one. Naturopathic doctors are big on the body can heal itself. You just have to give it the right environment, the right support, and a lot of the time your body knows what to do.
Mm-hmm. 6 round, prevenir, or to prevent, basically. So we don't just treat chronic illnesses and all of that. We also want to support the body to, protect ourselves from these chronic conditions later in life.
Yep, easier to prevent than to treat an actual disease.
Yes, you don't want to wait too long.
And
the last one, vis medicatrix naturae, restoring the vis. So what is the vis? That's an excellent
another question.
Yeah.
Life force. So vis is the naturopathic term for the life force. You hear this in other systems of healing too, like Chinese medicine talks about qi, Ayurvedic medicine talks about prana. That's the life force that we all have within us.
Yeah, and we want to support that as much as possible. So if you look at kids, they've got a ton of vis versus like the elderly. So you can see that energetic difference. But we want to promote that as long as we can. Okay.
Next question?
Yes.
What education do naturopathic doctors have?
Yes, excellent question as well. So we have the standard 4-year medical school education, and we actually learn the same stuff as medical doctors or conventional medical doctors do, as well as on top of that, we have to learn all the stuff we need to know. So botanical medicine, nutrition. We have a ton of hours of nutrition compared to medical school or traditional medical school. Physical medicine, yes, homeopathy. We learn a lot in naturopathic medical school.
There's definitely more modalities covered, whereas the allopathic medical school program really focuses on training you on medication, surgery, other interventions that are allopathic. We cover a wide range of treatment options. And to get into naturopathic medical school, you do also have to have a bachelor's degree in the science prerequisites similar to any other pre-medical program. So you have to complete that before you're even qualified to go to the naturopathic medical school as well. Next question. What prescription drugs do naturopathic doctors avoid?
Well, I can think of like big 3.
Yeah, that's what I was thinking.
So antibiotics, statins, and birth control.
Those are literally my top 3, like off the top of my head.
Yeah.
Yeah, they do more harm than good. Most of the time, there's a time and a place for everything. But yeah, we like to keep you off of those meds that just, again, suppress your symptoms. Let's figure out why you have those things in the first place and treat that.
Yeah.
Next, what do naturopathic doctors use for anxiety?
Oh, there are many
There's a ton of
options.
things.
Yeah, there's
There's
herbs,
not one thing.
There's adaptogens, which are also herbs.
I think the lifestyle piece is huge. A lot of doctors don't talk to you about your stress management tools. It's how can you support your anxiety if your nervous system's not even set up to deal with the anxiety experience.
Yeah, and mind-body medicine, which we
both did.
Yeah, mind-body medicine and meditation go a long way, especially breath work as well.
What supplements do naturopathic doctors recommend?
Oh gosh.
Well, first thing first, quality supplements, because quality is a big issue. So please do not go and just buy whatever supplements at Costco and Google and whatever. Supplements are not created equally, okay? They are not regulated, which means that these companies can kind of put whatever they want in it and don't have to prove it. I mean, there's studies on this. There's not even the active ingredient that they're claiming is on the label in a lot of these supplements. So you do need to be taking supplements that are high quality, third-party tested, proven to have these actual ingredients in them, plus no other contaminants like heavy metals and molds and all these other things is important. So high-quality supplements is my answer.
Excellent point. It really depends on the patient, what their lab work looks like, their symptoms. Again, we're treating the whole person. So it's not just like one supplement that I think everyone should be on.
No, never.
All right, we have why are naturopathic doctors better? Well, in many ways. We get to the root cause. We don't just treat the symptoms. We treat the whole person. Just like all of the principles that we just talked about.
We're just a great addition to your team because we look at this from a different perspective, which is always helpful.
Okay. Why do doctors hate naturopathic doctors? That's a strong word, hate. I mean, I think maybe it's because we can heal patients that they can't.
I mean, they're going to say we're not real doctors, which is pretty common.
That is also very
One,
true.
they think we're not real doctors. We run a bunch of unnecessary labs. Yeah, that's a big one. We like to take patients off medications.
Yeah,
a lot.
Not good for
Not good for business.
or insurance.
Insurance,
Yeah. Let's not make that list too long. All right.
Let's keep it short.
Why do naturopathic doctors focus on gut health? Excellent question.
The gut rules all.
It does. That's like the source of a lot of conditions, a lot of autoimmune issues. There's a lot of like gut brain, gut skin, gut joint axes that you don't even really realize.
Neurological conditions, a lot of times it's in the gut is one of the factors anyways. There's many factors, but when patients kind of don't know where to go looking at the gut or they're not getting results, revisiting gut health is something that I feel like always moves the needle and like creates improvement for people.
In some way, someone's got some gut issues.
Gut needs some help.
Yeah.
Needs some love.
Okay, so why do naturopathic doctors hate birth control? No comment. Just kidding.
Here's my biggest.
Yes.
Okay, I hate that so many patients are misinformed and think that their birth control, when they stop taking it for that 1 week of the month, that they're having a period. You're not having a period when you're on birth control. What birth control does is it suppresses your hormones so that you don't have a period, you don't ovulate, and then you don't have an actual period so that you can't get pregnant. That's what it does, that's how it works.
Yeah.
So the amount of women that think that they're having like a normal cycle and really it's just a withdrawal bleed from the hormones. So it's confusing and it shuts down the hormones.
Right, and it doesn't actually treat like the issues that they're being given. So, you know, PCOS and, you know, other
Painful periods.
Yes, PMS.
Heavy
even.
bleeding, PMS, yeah, PMS, literally,
Like-
everything.
Yeah, come on. Right. Why do naturopathic doctors do so many tests?
I love tests.
Why
I love
do we do
tests
that?
because we want to figure out what the root is, what we're treating. I don't like to guess. I mean, I'm a little bit more on the test, don't guess,
Yeah.
so that you can do targeted treatment plans
Yes.
that are actually addressing what you need, because there's a million supplements, there's a million tools and things you could be doing even just to optimize your health, but I think it's important to test and know what you're targeting so you can
Yeah.
be efficient and effective.
Yeah. And also the patient's more informed of like what shape their body is in prior to doing any treatments, and then you can see that baseline and compare it to after.
So true.
Okay, last question. Why do naturopaths
Naturopathic doctors.
call themselves doctors? How rude!
Because we are doctors.
But this, naturopaths in California, that's not a protected term. So anyone in California who's calling themselves a naturopath is not a doctor. Naturopathic doctors have a medical degree, 4-year medical degree, such as these two right here, okay? So
And a license.
yes.
And you
we are
pass
licensed.
licensing exams. We're certified by our board of naturopathic medicine and have a license in practicing naturopathic medicine that's within our scope in this state. So,
So we can call
naturopaths
ourselves.
is kind of like a more of a general term, and there's some more kind of classical naturopaths, and they learn some of the components, I would say, that are similar to the founding principles of naturopathic medicine, but it's not the same training and it's different.
So they can't call themselves doctors.
Yeah, so naturopathic doctor is key.
Drop it. Drop the mic.
Boom.
Is that on camera? Yes, it is.
All right, on to our how naturopathic doctors. How do naturopathic doctors balance hormones? Not with birth control, as you may have guessed.
No. There's obviously bioidentical hormone replacements, but there are different forms, right? There are creams, there are gels, there are troches, there are patches. And there's also not just like static hormone replacement that you would normally see. There's also rhythmic, where you can follow the natural cycle of a woman's hormones. And what else? Oh, there's herbs.
Herbs and supplements can
Yeah.
be super helpful in balancing hormones. Also, I think people always think about adding things on. Sometimes you gotta take stuff away to balance your hormones, like alcohol, for example, or stress, or like unhealthy habits, patterns, improving your diet.
Energy.
Just don't have toxicity in your life. And a lot of times that helps out your hormones.
And not just in like the mental emotional toxic. I also mean like toxins in the environment.
Yeah, literally,
right?
yeah. Plastics, all that kind of stuff can definitely mess with your hormones. So assessing and then removing some stuff can also help with balancing hormones. How do naturopathic doctors avoid prescription drugs?
We just don't prescribe them?
Yeah, you basically just don't prescribe them and that's it. Easy. Next.
Next.
How do naturopathic doctors test for food sensitivities?
How does the lab do it? They test for IgG, which is an antibody.
It's a blood draw. Honestly, I don't do a lot of that.
Yeah, me neither.
I don't really do a lot of food sensitivity testing. Main reason being, so many people come back and they seriously have like 20 plus foods that they're sensitive to. And then it's not that helpful. It's more of a sign of your gut barrier being disrupted, which is creating the sensitivities in the first place. So,
Or leaky gut.
Leaky gut.
Intestinal permeability, same thing.
Yeah, and I also just see so many people struggling with removing foods, and it becomes more stressful to eliminate these foods, which stress doesn't help leaky gut, by the way. And then it's a whole spiral situation. So there's a time and a place. Not to say I'll never do it, but it's not my top test. How do naturopathic doctors treat ADHD?
There are a lot of links to different things, right? So like the food dyes, which great job, finally, FDA, taking that shit out. So the red food dyes, sugar. Yeah.
Genetic SNPs, predispositions, making sure you're optimizing metabolism of certain neurotransmitters, all that. Herb supplements, of course. I
Yes.
mean, there's so many things
Actually,
to use
saffron,
for it. Oh, that is a big one.
that works just as well as Ritalin. So, good one.
Facts. She's never wrong. I swear to God. Look, fact check. How do naturopathic doctors treat depression? I mean, similar.
Yeah,
These are both within the
similar.
mental health realm. And then, I mean, of course, we touched on gut health. Looking at also from a whole body perspective, what other things are going on. Not just treating the depression, like treating the whole body and seeing what else needs to be supported.
Yeah, it's like, especially like nutrients, vitamin D, so
Yeah.
important. That's like a big one. That's a huge cause of depression. But yes, we can go into deep detail about that, but that's gonna be a long video.
We'll save it for next time. How long is an appointment with a naturopathic doctor? The longest appointment you'll ever have with a doctor.
Like almost like 90 minutes sometimes.
It can definitely be 90 minutes easily. It could, seriously, it could be 24 hours, I swear. But I mean, like an hour is kind of classic
as usual,
to be
the
expected.
norm. But yeah, but more than you'll get at a hospital.
All right.
That's a wrap! Pull back! Go ahead, you can do it.
All right.
Like and subscribe. Give us a follow.
We're trying to do an outro.
Okay, go ahead.
All right. Thank you guys for joining us and listening to us do the Google interview. It was fun.
Yeah, it was. We should do this more often.
We hope you learned something about naturopathic doctors and come see us at Holtorf Medical Group. We'd be super happy to help you get to the root cause.